it's Khaki. Today, I would like to address some concerns and some advice for those of you who are in the pre op stage, things that might make that immediate post op stage a little bit easier. I know for me, those weeks leading up to having surgery were very stressful. I was really concerned about what my life would be like after surgery. Of course, we all have fears regarding surgery. That is perfectly normal. But I want to talk about things that I found to be helpful and that my patients have found to be helpful, and some things that not so helpful that maybe you don't want to go through. First up, I highly suggest that before you have surgery, you check out your local resources available for IV hydration. Your main risk after surgery, the most common reason that people are hospitalized after bariatric surgery is dehydration. It is very hard for some of us after we have bariatric surgery to get the fluids that we need to avoid dehydration down. I know I ended up having to have IV fluids I think I was day 3. I started getting tachycardic. My heart was beating fast. I started getting dizzy. I was extremely tired. I knew my intake was not what it should be. Thankfully, due to my profession, I had access to IV fluids, but you can save yourself a lot of worry and money if you plan ahead. There are a lot of reputable IV hydration places now that are run by nurse practitioners, doctors, PAs. Locate one. Call ahead. Ask, if I need this, how much is it going to be? What are the hours? You may not even need it, but it will save you a trip to the ER if you do. Another thing that I feel like that really stresses people out is worrying about getting their protein in that immediate post-op time frame. Don't sweat it. You're not going to get your protein in. It's just not going to happen. It took me probably 6 to 8 weeks to be able to hit my protein goals after surgery. You need to focus in that immediate post op time on hydration, number one. That is something that can get you in immediate danger. Number two, when you're able, start taking your vitamins. And number three, protein. A true protein deficiency takes months to develop. Dehydration can take a day. So don't sweat the protein. You'll get it in. It took me probably 2 months before I could drink a protein shake after surgery. They made me so nauseous. Worry about the hydration. I promise the rest will come. Another thing that I would advise people to do is prepare. Prepare. Before, I know my post op diet, I was on liquids for 2 weeks. I made several different types of different broths before I had surgery. I got these 1 cup, kind of like ice trays on Amazon. I made my broth either in my crock pot or my pressure cooker. You can go to Pinterest and Google broth, bariatric broth, and come up with tons of different flavors. That is what really kept me going. When you could not eat, I looked forward to getting that broth in, those different flavors. I did like a French onion broth. Of course, there were no solids, but I did a French onion beef broth. I did a lemongrass chicken broth. I did a Mexican pork broth. I mean, I had tons of different varieties. So I wasn't just relying on that store-bought broth or bouillon that can become so repetitive. Do that before you have surgery. Freeze it, and then you will be set. You are going to be tired in that immediate post-op period. There's no way around it. That's one of the things that I think takes the longest to overcome. I felt very tired for maybe a month after surgery. It just is what it is. So anything that you can do to get ahead of that, if you can go into surgery with no laundry that you need to do, with your cabinets cleaned out, all the things that you might have to do in your day-to-day life, if you can prepare and do them before, so after surgery you're not having to sweat that kind of stuff. Another thing, don't buy a lot of crap. I know I went on Amazon and I looked at different people's bariatric shopping list. I watched TikTok videos, I watched YouTube videos. I loaded up. I had a Cremi, which I ended up not being able to use for about a year. A whole different story. Didn't like the sweet taste. I bought a bunch of shakes, which, as I said, I could not tolerate for several months. I bought mixers. I bought blenders. Chances are you're not going to need that in that immediate post-op. Really, the only thing that I used was a hand mixer making shakes. I did make like some I found one brand that had more of a fruit flavored protein mix. I did was able to get a little bit of that down. But other than that, I didn't need any equipment. So you don't know how your taste is going to change after surgery. So it's not like you're going into a bunker and you'll never come out for a month. You can, just get the basic necessities and make things ahead of time. Um, Another thing that I would highly advise you to do in that pre-op, read your binder, read your program info, read it over and over and over. Know what to expect. Ask any questions that you have. Be satisfied with the answers. You're not going to think of everything, but just don't go into this blind and unprepared. Another thing that I really advise people to do, build your nest. I was able to lay down and sleep within a couple of days after surgery, so I was okay, but you might not be able to. So get pillows, get your blankets, get your chargers ready, get all the things that you're gonna need to make you comfortable. Have it waiting on you when you come home from surgery. Have your little nest ready. Don't wait till you get home. This also goes back to preparation. I had a patient that on the way home from the hospital, she had to stop at the grocery store because she had nothing. Don't do that. Be ready ahead of time. Another thing, build yourself a bubble. Don't, this is not the time to make yourself miserable by pleasing everybody else. This is not the time when you can't eat, it's probably not the time to go to family dinners and just watch everybody else eat. It's not the time to go out for pizza with your kids and suffer because you can't eat. Explain to your family, explain to your friends for however many days, however many weeks, I can't do this. I'm sorry. I have a patient who her husband really pressured her into going to Buffalo Wild Wings with the kids. She was so miserable and felt so deprived and was so stimulated by the smells, and it was somewhere she used to love to eat. She ended up drinking a half a cup of ranch dressing because that was all she could tolerate. Don't be the person who has to drink the ranch dressing. There is such a thing as bullies who are like, come on, just go with us. You don't have to eat anything. Set boundaries. Say, this is a time it's too hard for me. I need to take care of me right now. It's a short term thing, but be strong. You're doing something wonderful for your health, and you deserve to be able to do it in peace. So build those boundaries. That is all that I can think of. The other thing, don't worry about the soft food diet a month down the road. Don't worry about anything. Focus on now. A few days before you start soft foods, start thinking about it. But really, I was worried about what I was going to eat in 6 months. I'd love to have that time back because it changed from what I thought it was going to be. Think about right now. Think about what you need to do to get ready. Think about preparation. Think about that immediate post op period. You are making a huge decision and something that for 99% of people changes their life so much for the better. You deserve to do the things now that will make that successful for you. I would love to hear from anybody who is pre op. What are your concerns? What have you done to prepare? Anybody who is further down the road, what did you do that maybe you wish you'd done differently, or what did you not do that you wish you had done? Would love to hear video ideas. Anything you would like to hear me discuss. I'm leaving in the morning for a long weekend in Mexico with the girls from my office, so I'm really looking forward to that. It's amazing to be able to go and enjoy things like that. And know that my sweet husband, he knows that I need some me time and some rest and supports me fully. I will see you next Wednesday, guys. If you have any questions, please reach out and I'd love to hear from you. Bye.